Welcome to Monday Masterclass. We're going to be talking about the truth about GLP-1s and what the headlines aren't telling you. This is why this webinar, this is why this is being created. I have seen with my own two eyes many people saying, well, what's the ingredients in the GLP-1 shots and how can I trust it? And how would I know what it's for if it's for me? I used to take it for 7 months and then I got off of it and then now I gained all the weight back. And then now I'm trying to get back on it and it's been, 4 months later and I haven't lost but even a pound. Y'all, this is why we are having this conversation today. This is why we're having this conversation right now. And this information will be very much important when you watch this, I'm sure, even a year from now. So, but there you go. This is not medical advice. You do you, but receive this information as well as you can because this is information that you've been asking for. So, today's topic is one of the most discussed health topics in America right now. GLP-1 medications. You may know them as Semaglutide, Ozempic, Wegovy, Tirzepatide, Mounjaro, Zepbound, Retatrutide. Now, depending on who you ask, these medications are either a miracle or a disaster. Today, we're going to step away from social media opinions and talk about what the science actually shows. As always, this class is for educational purposes only. I do not diagnose, prescribe. I don't even replace your physician. Okay. My goal is to help you better understand your body and your options because normal doesn't always mean optimal. So let's begin with a very basic question. What is a GLP-1? Many people believe these medications are foreign chemicals or toxins. They are not. GLP-1 stands for glucagon-like peptide 1. It is a hormone in your own body that naturally produces it after you eat. If you are someone who does not create this GLP-1 hormone, then we need to have a discussion, or you need to have a discussion with your, I was going to say endocrinologist, but I'm pretty sure that's who you would see. Yeah. So just so you know, the glucagon-like peptide 1, its job is to help regulate your blood sugar, your insulin response, satiety, which means you're full, your appetite, which means I'm hungry now, I'm not hungry now. Also, digestion. The medications are designed to mimic and extend the activity of this natural hormone. Well, in simple terms, they help people feel full sooner. They stay full longer and reduce food cravings. I have remembered so many times of people saying that they wished before they had their gastric surgery. Well, there's been many types of gastric surgeries, so I've heard it from all. And they said, I wish this was around before I had my procedure. I wish that I had this information. You know what? Well, it is up to your provider to have that conversation with you. It is up with your surgeon. It's up with the medical team that you hired, either from your insurance company or however you did self-pay. It is up to them to make sure that you have this education. So, this is why the GLP-1s can be so effective for weight loss and metabolic health. Please remember that part right there. The feeling full sooner, staying full longer, and reduce food cravings. Yes. Let's talk about metabolic health. Well, let's also discuss the benefits. The first and most obvious benefit of this is weight loss. This hormone, this 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 GLP-1, it is so obvious that it is for weight loss. Are there other ways that providers use this medication? Well, that's not what we're talking about right now. We can talk about that offline when we do the question and answer portion of the Monday Masterclass. Many studies have shown average weight loss ranging from approximately 10 to 20% of their starting body weight, depending on the medication and individual circumstances. But weight loss is actually only part of the story. Remember, we're talking about the things that no one tells you. I'm telling you the truth. I'm telling you the headlines. I'm telling you what the headlines don't tell you, right? Weight loss is only part of the story. What excites many health professionals is what we're seeing beyond weight loss. We are seeing improvements in blood sugar control, insulin resistance, blood pressure, inflammation, fatty liver disease, and overall, here's the word again, metabolic health. We are also seeing cardiovascular benefits, that pericardial sac around the heart. We're seeing that that is having the GLP-1 is having a benefit. So there's not so much pressure around the pericardial sac. Some studies have demonstrated reductions in major cardiovascular events in high risk individuals. So that includes heart attacks and strokes. So, I mean, as a stroke educator, that does get my attention because many of the same risk factors that increase stroke risk also include metabolic disease risk, like obesity, diabetes, high blood pressure, insulin resistance. So when we improve those conditions, we often improve overall health outcomes. Oh my goodness, this is such a joy. This is the part where I will use my nurse brain and I will tell you that also I am not naive to think that this can be done with just the shot only. I am not that naive. I know that nutrition education is crucial along with GLP-1 medications. I am telling you right now, I am not seeing it. I have seen people have a consult with a dietitian, but it's not effective. There is no RN level education. That is not to say that a dietitian or a nutritionist or a diabetes educator is anything less special than an RN. But just be mindful that RNs, it literally, like, I'm so sure of it that it says between the word register and nurse equals educator. It's the educator because we go to school for it. It is what we do. Is it covered by insurance outside of a hospital or a doctor's office? No, absolutely not. Unless you use your HSA or your FSA, but that's you spending your own money anyway. So who are they to tell you what to do with your own money? That's really just the nuts and bolts of your healthcare spending account and your flexible spending account. I mean, unless it's a perk of the business that they are choosing to give you, say, $30 a month for your HSA card. I mean, you're working really hard. So, but it's not part of your paycheck. All right. Another fascinating area is what many patients describe as reduced food noise. So, food noise refers to that constant mental chatter around food, like thinking about food, craving food, planning the next meal. This isn't that mom or that dad that is the main cook of the home, not the one that's going, okay, we're at breakfast, but do I need to set out something for dinner? This is not what I'm talking about when I say planning the next meal. I am talking about someone who was eating lunch and going, oh, yeah, I've already had three slices of pizza, a salad, and a soda. Okay, so I also think that I could do this burrito. I'm going to go ahead and get this burrito right now because I'm going to need this burrito because I am hungry and I don't like to be hungry. Okay, remember we're talking about food cravings, thinking about food. The thinking about food part, I'm going to put this into um a very real story. Let's say you work in a cubicle and you are someone who always has snacks in your desk. So you go to lunch and you have your soup and salad, and you've got a maybe a water that day. So you had your soup and your salad. Your salad had chicken breast on it, and your soup um, I had a few vegetables in it and maybe a few meats, right? And then you eat your lunch and you eat it all. And then you go to your desk and it's like, it's been 30 minutes. It's been 30 minutes since I've eaten. I could eat this snack. And then you see the Snickers or whatever the candy bar is in your desk. And you're thinking, ah, you know what? I had something really salty for lunch. So, what I'm going to do is I'm going to offset that with something sweet. So then you go and you are really adorable and you open up the package of the candy bar and you tear it in half, right? I mean, we're not going to eat the whole thing. So then we tear it in half. We eat a little nibble while we check a few emails and then next thing you know, it's like gone. We're already licking our fingers because the chocolate is on our fingers. And then there we go. And then we are checking a few more emails, getting a few things done. And you're like, that was so good. Like, that was really good. And then you're like, you know what? I ate really good for lunch. So I don't think I ate all my calories. I don't know. So, this has my candy bar has nuts in it. I was told I need to have some protein. I'm just going to go ahead and break it off again. And then, so now you have a fourth of the candy bar still left. And now you've consumed three-fourths of the candy bar. And then it's like, oh, that's going to get so gross. It's going to get so gross in my desk. I don't, they told us that we have an ant problem, or I just really don't want us to have a roach issue. So I might as well just finish it off because I've closed it up, but I really don't think it's like all the way closed. So then you just eat it, toss it in the trash, and then your stomach hurts. It's that last bite that you're like, God, why did I do that? I wasn't even craving it. Right now, that's, you know, 300 calories plus 26 grams of sugar. I'm only supposed to have 20 grams of sugar in a day. Now what am I going to have for dinner? And then you're thinking, oh, do you see what I'm saying? Well, for dinner, now I'm going to have just a glass of water, or maybe I'll have like a protein shake for dinner. This is where it comes from. Okay. Many individuals report feeling a level of freedom from those thoughts that they have never experienced before being on a GLP-1. Remember, it can either be a miracle or it could be the worst thing, right? So researchers are now studying whether these medications may influence other reward pathways in the brain. So now let's talk about the concerns because every medical intervention deserves an honest conversation. The first concern is gastrointestinal side effects. This is by far the most common issue. Raise your hand or put it in the comments If you have experienced on a GLP-1 shot, or now they have the oral, which is by mouth, the tablet that you would consume with water. How many of you experienced nausea, vomiting, constipation, bloating, reflux, or stomach discomfort? Many of these symptoms may improve over time, but they can be significant for some individuals. When I go back up to these issues, my nurse brain goes right back in and says, okay, are we having these experiences because of the food quality not being optimal? Is the food quality the same that it used to be before getting on the GLP-1 shot? I will tell you this. I tell my clients it is a lifestyle change. If you are going to get on a GLP-1, we are talking about a lifestyle change, because how we got here, how did we get here? Was it for over consuming? Was it because of genetic issues? Let's uncover those. Okay. So here's my second concern: muscle loss. This is one of, I feel, the most important conversations that just gets overlooked, because when people lose weight rapidly, some of that weight can come from muscle. Muscle matters. Your muscles support your strength, your mobility, your metabolism, and also healthy aging. We need those strong muscles to support our bones so that we are not falling and breaking apart. This is why protein intake and resistance trainings, remember we were talking about our our muscles and our bones, right? Resistance training, they are incredibly important while using these medications. The goal is not simply weight loss. I've heard of brown fat, white fat, gray fat. I've heard of it all, but you haven't. The headlines are not talking to you about the muscle loss. Your provider is probably not measuring you in your upper arms, in your waist, in your upper thighs. If they are, I'm going to give 10 woohoos, because that is going to tell us, are we checking? We're probably looking at the BMI. That's great that you lost 70 pounds, but was that muscle loss? There is a way to check. Okay. Because the goal is preserving health while losing weight. Here's my third concern, and it involves nutrition. Yup, I went ahead and we're just doing it. We're doing the thing. We're talking about nutrition because appetite often decreases significantly. Some individuals accidentally undereat. So on a GLP-1, I've heard people say, I just wasn't hungry for breakfast and I only ate lunch today. And I'm thinking, okay, are we intermittent fasting? No, we're not intermittent fasting. We just had a cup of coffee with a little bit of creamer because we weren't hungry. We need to have a conversation, because if intermittent fasting is for you, just remember, is your body type okay with intermittent fasting? Or is your body saying lunchtime is coming and then you finally started to feel hungry and then now you're eating, but then you got full because you ate half your sandwich. And then for dinner, you're like, ooh, all I can have is an apple. Please. If that is your daily intake and that is not optimal for you, a cup of coffee with creamer, half a sandwich, and an apple throughout your day, if that is not optimal and quality, that can lead to nutritional deficiencies. If you are not intentional about food quality, you can accidentally undereat. This is why education on a GLP-1 for nutrition is so crucial. Yep, you got the shot. Yep, you went to the pharmacy and you got your good deal, or you've seen your provider and you already know how much you're going to pay. And you're thinking, this is so good. I'm saving so much money on my food bill. Like, where's this been all my life? Mm-mm. This is where education becomes extremely important. And then there are the less common but more serious risks that include your gallbladder concerns. How many people, after being on a GLP-1, have had a cholecystectomy, which is a gallbladder removal? How many have had gallstones, the pancreatitis? What about specific thyroid cancer precautions for individuals with a personal or family history of medullary thyroid carcinoma or MEN2 syndrome? These are important conversations to have with your healthcare provider. Now, let's discuss something that rarely gets talked about. Okay, I mentioned it a little bit before. Again, what the headlines aren't telling you is that weight regain. I think it is such a I think it's such a wonderful idea to think that being on the GLP-1 shot, getting to your goal weight, which was getting your BMI of whatever you needed to be between you and your provider. But here's the thing. Did you change your lifestyle? Did you change how you were eating? Did you eat optimally and with quality when on that GLP-1? Because if you didn't, I'm going to say this. Your risk of regain, it's astronomically high. Because many people actually assume that these medications permanently solve the problem. No, but obesity and metabolic dysfunction are complex biological conditions. And if someone stops a GLP-1 and has not built a strong nutrition, exercise, and lifestyle foundation, weight regain can absolutely occur. It's biology. And that brings me to what I believe is the most important message of today's class, of this webinar, of this moment, is a GLP-1 is just a tool. It is not a replacement for understanding your body. The question isn't, does a GLP-1 work? Because for many people, the answer is yes. But the better question is, how do I use this tool wisely? That includes adequate protein, strength training, sleep, stress management, hydration, and personalized nutrition. I love in the women's group that I love inside there. They get me 24/7. They get access to ask me any questions. They pay a monthly fee for it because they get me 24/7. They get to ask the questions, and especially if they're on a GLP-1. And if even though they're not, they will get a tailored 30-day meal plan, breakfast, lunch, dinner, 2 snacks, and a smoothie if that is something they want. That is tailored just to them. And especially if they are on a GLP-1, we are talking about lifestyle changes. Okay. Now I understand there may be a medication, there may be an event that happened that caused you to gain weight. But just be mindful that You might go through a detox of whatever that treatment was. You might go through whatever it is, but did it change your metabolism? Because if so, we've got to change some things, okay? Um, One of the reasons that I'm super passionate about genetic nutrition testing is because understanding your body's unique blueprint can help create a more individualized approach to health. I love that genetic nutrition testing is once in your lifetime because your genes don't ever change. So just be mindful that you might have been through a diagnosis, you might have been through a medication. This does not change your genes. Okay. So, because your genes, they influence your caffeine metabolism, nutrient processing, inflammation patterns, exercise response. Oh my gosh, and so much more. So, the more we understand the individual, the more strategic we can become. So, what is the bottom line? GLP-1 medications are not magic. They are not toxins. They are powerful metabolic tools. For some individuals, they can actually be life changing. For others, they may just not be the right fit. And obviously, we talked about a couple of those up there. Okay. The goal is not fear, the goal is education. And when we combine education with personalized health strategies, yes, people make better decisions. So, thank you all so much for joining me for today's masterclass. Monday masterclass is every single Monday at 4:30. You have to be in the Self Care University OK Wellness group on Facebook to automatically get the link to see this and to watch this, to watch the replay and to ask me the post Monday masterclass questions. You have to be in the women's monthly subscription group. It's not what it's called, but I try not to just read the descriptions. There you go in this video and you will find it. But if you would like to learn more about hormone health, metabolism, inflammation, genetic nutrition testing, or educational wellness support, I invite you to visit my website or schedule a free consultation. I'll see you next Monday for another Monday Masterclass. Have a wonderful week.